Senegal remarkably survived quite well. There were, correct me if I'm wrong, but there was one death. There was one.
One case.
One case. One case.
No deaths.
No deaths. One case of Ebola. Can you, before we get to what worked and why that was the case, would you mind giving us a sense of what it was like to live through that, and from a personal perspective, but also as someone who could understand scientifically what was happening?
I think that everybody here has heard a lot on Ebola because it was very well documented and in TV, in radio, in media in general. But I want people to understand that for West Africa, it was the first time we had this type of epidemic. We didn't know that. I am an infectious disease specialist. I was teaching at the university, and every time I was looking at hemorrhagic fevers, I was just saying, like Ebola, like something. It's how we teach Ebola to people, because it was not our business. And when we heard that it was very far in Zaire, and for us it was not part of our day-to-day work. And suddenly, in Guinea, we heard that something new was there, killing people, weeks by weeks, until almost 3 months. Nobody was knowing what was this disease. And a day, people say it is Ebola. Everybody was panicking because we never thought that it will be in West Africa. And we knew also that this Ebola epidemic was killing a lot of people. And it was really, for the countries themselves and those who were around, a big problem. And the 3 countries, Guinea, Sierra Leone, and Liberia, was more fragile in West Africa because some was coming from war, others from civil, etc. And the disease arrived, and in 2 years, you had something like around 28,000 cases and 11,000 deaths. This was a big story in West Africa. WHO, a lot of other organizations came very late in the process because this has surprised everybody. Senegal, as soon as we heard that the disease was in Guinea, not far from us, we started to work on that. We didn't wait to have a case to organize ourselves. And we saw that it was important to have a strong leadership and a political will. Because what we realized is that in a lot of countries, they knew that something wrong was happening, but they didn't want to say that because they hide it a little bit. Because, if people know that this disease, very dangerous disease is there, maybe we will have impact on tourism or this and that. But we decided not to hide anything. If we had a case, we will show it, and we will say that Senegal have it. It will be difficult, because at this time in WHO, when a country in this area had one case, it was red. And CNN was showing Senegal as red. But CNN has never shown the US with some cases coming on red. So this is why the countries also were a little bit afraid. So this is a problem. So this was what happened. And we in Senegal, we decided to go ahead. And we were very lucky to have a lot of partners, including the US and USAID, but also the CDC. These are our friends. I don't know if somebody from CDC is here, but really it's Senegal. Now they are very famous. And they were with us, and we organize all our preparedness, and when we have a case also, to look at all the contact people, all this thing was very difficult. At the end of the day, the result is that we had only this case, and the gentleman has been at funerals in Guinea of a brother, a cousin, I think another person, 3. He has been detected as a contact person, but no discussion between the countries. And when they lose the person was coming to Senegal, but they didn't know where the person, and they didn't tell us that the person was coming to Senegal. So it was the story. Now, at the end of the day, what I can say is political will, coordination of partners and partnership is very important. But community involvement.
What does that mean?
That means that we use women association, youth association, faith-based organization, religious leaders. I can tell you that personally, I was in charge, and I tapped everywhere. Every people who can help were involved in the preparedness and in the response, because we decided that all the people who are working on determinant, like sanitation, water, and all these things, need to be part. But all the sector also where you have impact, like tourism, like trade, like education, because you know that the almost months, but we can say 1 year has been lost in Guinea. Children was not going to school. So we work with education to say if things happen, what we will do, etc. So everybody was involved. And this is for me one of the secrets of the success, because it was a real multi-sectorial approach with community engagement and empowerment, because they were trained to understand what happened, and they were at community level pushing for clean water, but also washing hands and all these type of things. And everybody was very engaged. And this is...
How do you sustain that level of engagement without another epidemic to spur it?
What we have done is that we were all involved 24 hours in 24. We didn't sleep. And we decided this cannot continue. If we have another epidemic, we will not be just doing the epidemic, not doing reproductive health, we are not doing malaria enough. And it is why we have decided to create this center of health emergency. And it is where we are working with CDC. And this center will be working every time, every day, but the system itself will not be completely jeopardized because of one disease or one epidemic. So this is a lot of things done, but I can tell you that it is something when you go through, you are able often to do a lot of other things, because it was a learning process. We didn't know. We were learning by doing. And we need a lot of humility when we are in this situation, because if not, you need to know that you learn, and you can be successful or not. But we have been successful, but I can tell you that it is also linked to the system itself. And we need to have in our countries resilient system, because it is so weak. Often, if you look Sierra Leone, Guinea, etc., they didn't have enough doctors, they didn't have enough nurses, they didn't have structure, they didn't have labs, it was, now when an epidemic like this happens, it's always just disturbing everything. We need really resilient system. And this is what we are building in Senegal.
You mentioned the importance of the partnership with the United States through that crisis. And that leads me to kind of the penultimate question here. We are sitting in Washington, D.C. We are sitting in the first year of a new administration. And earlier, Bill talked about the Trump administration's commitment to global health. But no one would doubt that this is an administration that has taken the opportunity to reassess international agreements and look at partnerships and try to figure out if they're working or if they're not working. And so it is appropriate to ask how each of you view America's leadership in global health, what the risk is for withdrawal of American leadership in global health. And I'll start with you, Minister.
Start by me.
Yeah.
Admittedly,
You might be
before.
safe.
No. Well, I'm just going to take responsibility for the minister always being looked to first, because I do think it's important that countries be at the center of the conversation. And so when we were talking backstage, which was outlining what was going to happen, I said, I was completely comfortable with whatever she would ask, and I'm happy to also answer the question she just posed. But it was important, I thought, that on all the significant matters, that the minister get to go first.
She's also wearing an awesome orange dress. And my eye
And
just
for that.
keeps-
And we are dressed in similar shades of plum. And
Go
we
in.
just,
No, I am ready also to respond, because the American governments, the American people have done so much in global health, have now enough elements and enough result and achievements they can see. And it is why, it is not because Bill is here, but for me, when I see some people, I just think that we can have hope, that this can continue. Because these are not people who have not done global health or don't know global health. They have been involved. I have knew Bill in the Global Fund. It's a long story. They are not new. Some of them can guide and explain, because I think that if we look at all the achievement, something is very important to sustain this achievement. If I look at a disease like malaria that I know a little bit, I can tell you that if we are not sustaining what we are doing, and PMI has played a so important role, that it will come back with epidemic and situation worse than what we had before. And some people are there and they know that. Another thing for me that I trust that support need to continue is the global security, global health security. It's important for the US to understand that supporting our countries to have strong preparedness and response to epidemic will protect the US. It's a win-win situation. If we are weak, everything will come. We have no borders, no passport, no visa, if it is a disease. So it is for me a good sense, and I am sure that people who are now advising and proposing solution will help. Maybe one of the things, and I jump on that, is the issue of reproductive health. I have heard a lot of noise around that. But there also, if you look at some countries like Senegal, we were very weak with 12% of coverage for family planning, 12. In 4 years, we have doubled it with the support of all our partners, including the US and a lot of NGOs. Now we are around 25%. And our objective in 2020 is to have 45%, and after to go again, continue. Because we think that if the women continue to have 6 children, it's difficult. Chelsea, you were saying that you have 2, I think? Yes. With the 2, you have enough job, no? If you want to have 6, you need to take...
I don't know where this is going. I'm like, oh goodness gracious.
You can come and learn in our country how to do with 6 children, but it is also blocking a lot of potential of women. And the role of women in the country will be difficult, and the empowerment we want for women will be difficult. The same, all these children, you need to give them job. And if they have no job, they will try to come to Europe or to the US and start to create other type of problems. So again, it is a win-win situation. If we continue to have support on global health and global health security, I am sure reproductive health also is part of that. If not, it will be very difficult for all the countries, and the reaction or the impact later will be, for me, more difficult to resolve than if we continue to support countries, and the US, I am sure, will do the good choice.